Okay, so this was already mentioned earlier that we're looking at the context of chronic disease that are the main reason for poor health for 30% of Europe's population and accounting for a large amount of the healthcare expenditure in Europe. So with an aging population, there is an increase in the number of multiple chronic conditions, multimorbidity, and older people are having at least 3 chronic conditions and even more. So this is also reflected in a report in the Lancet, where the emerging agenda is the shift in the global burden of disease towards non-communicable diseases and the associated cost implications as well. So the challenge here is for the clinical management of the patients with multimorbid chronic conditions that is becoming more complex and also putting a further burden on the social care services. And there has been some shortcomings in the long-term care needs for patients within and between the different healthcare delivery organizations that need to work together. So as the shift of the care delivery for chronic patients is moving more towards the community-based setting from a hospital setting, we're looking at ways in which digital technology and digital healthcare can transform this care delivery, and it can help by bringing all these different sectors together towards an enhanced integrated care approach. So in this slide, just gives you just a summary of why technology can help to transform healthcare. So by linking the different electronic healthcare records, harnessing the large amount of data that's now being collected to help with decision making, the inclusion of decision support systems, and also having more and more tools for remote monitoring and self-management. And also the increase in, for example, online consultations and interventions that help to care for patients away from the hospital. And finally, the use of wearable and implantable devices that capture different physiological parameters. So for digitally enhanced integrated care, as there's no single model that apply universally to achieve the coordinated care, so the management and delivery of healthcare services as a continuum of preventative and curative services, according to the needs of patients, can be enhanced by using more of the adaptive and radical solutions that technology can support. And this has also been expressed by Sir Muir Gray, where a higher value can be obtained by using information and more of the digitally delivered evidence and integration towards care. So I'll just give you just a little brief overview before we move to the demonstrator. So C3-Cloud, we're looking at implemented integrated care by having different components. So there are two main user-facing components. So the first one is the coordinated care and delivery platform, which is being used by the multidisciplinary care to collaboratively develop care plans. And the second tool is the patient empowerment platform that patients and their informal caregivers use to also consult their care plans and perform activities in order to achieve their goals. So those two user-facing components are being supported by a set of clinical decision support services that look at risk assessments, reconciliation of guidelines, and drug-and-drug interaction, as has been mentioned previously. Additionally, the C3-Cloud interoperability middleware enables data from the different electronic healthcare systems, from social care and other IT systems to be accessible within a central place to enable the coordinated care. So this is a quick overview. So this is a summary of what I've touched on. So now my colleagues Mustafa and Pontus will take you through how the C3DP and the patient empowerment platform work.